In the first half of our program, we chatted with Dr. Maiju Wetzel, HOB Faculty Director, and Loyola student advocates Sidney Lagozo and Rafael Gonzalez. Now we meet with Dr. Robert Atlas, Chair of the Department of Obstetrics and Gynecology at Mercy, and two Health Outreach Baltimore volunteers with somewhat different perspectives. Akosia Aljomangdua, current Loyola student, class of 2027, and Patrick McGinnis, a Loyola University graduate now attending the University of Maryland Medical School and was recently in his rotation here at Mercy. Thanks for joining us all today. Now, Akosia, what's your experience been like working with local families, with those you work with, what their attitude was? Were they amenable to this? Do they have questions?
Yeah, it's been a very incredibly fulfilling experience. Anytime we get to get on the phone or talk to the client in person, they're always so excited to work with us. Obviously, sometimes you'll have the client who's like, are you trying to sell me something? But we're just like, no, that's not what we're trying to do. We're just trying to, bring more support and to be able to get clients connected to resources in the community. And they're always really excited to work with us and get connected to the resources that they may be struggling to get access to. We're able to really build a really strong relationship with them over the course of the semester. And sometimes you can work with them over the course of the year, just depending on how the schedule works. And we deal with a lot of sensitive and sometimes difficult topics, so we're able to really build a strong relationship with them over the course of the semester.
Patrick, does that sound like your experience? What's it like for you?
Absolutely. I think that aligns very well with the types of things that I saw in my time in Health Outreach Baltimore. I think I was really impressed and overwhelmed with joy at how open and trusting a lot of new and expecting mothers were to have these conversations about resources. I find that a lot of families want to have these types of conversations about accessing social resources. And I think Health Outreach Baltimore provided a venue where we could come into the room, meet a patient where they were, and talk about what they find important, what is the most important thing to them and their family moving forward. So I think that aligns really well with my experience.
Dr. Atlas, from Mercy's perspective, what does a program like this add to Mercy's mission and commitment to the local community, in your opinion? Do you think it's been beneficial? What kind of feedback have you got?
I think, as they said, it's incredibly beneficial for our parents and our families here. It's very challenging getting through the health system, and to have people who are coming there and offering you these outreaches, and some of them I probably don't even know, are incredibly beneficial to them and to our organization and all our patients. I mean, it's a wonderful relationship that we have with Loyola and Health Outreach Baltimore.
So you work with some of the HOB students yourself?
Yeah, I think we talked a little bit.
We did.
Yeah.
And what do you think you've gained from that?
I like the idea of seeing the young upcoming people, and I'm always asking, what are you interested in, and what part of the medical field are you interested in? I try not to discourage anyone, but being a doctor takes a lot of time, commitment, and energy. And my first job really out after residency and fellowship was at the age of 31. So, you give up a decade of your life for this, what I would call a noble profession.
Akosia, has anything surprised you? Anything you weren't expecting? And do you have any reflections to share about the families you've worked with?
Yeah, so we're able to work with a number of individuals and families over the course of the semester and over the school year. And I think one thing that surprised me was just how incredibly resourceful Baltimore families can be. When you're coming and working with them and you see just the extent of the things they've done to try and get access to certain resources. Some, they struggle more than others, and just how incredibly resourceful they are able to be to get access to those things or what they've done to get it. Also in the resources that we provide the clients, not all of them are big government or federal organizations. Some of them are smaller, small businesses in Baltimore. So it's really cool to see how Baltimore organizations kind of work together and create this network to support the families in Baltimore. And I think something that I didn't expect, or I guess something that I learned, was that it can be incredibly difficult going day in and day out when you don't have access to certain things like transportation to work, or getting your child care so that you can go to work, or getting food weekly for your kids in your family. So it really helps to see like the impact that we're making.
So often it seems in our society, things that, people call support services. I mean, just that very term makes it sound like it's ancillary and, quite frankly, not that important. It's like, oh, well, what do we need these support services for? And it's like, it's probably not the best term. There probably should be a better term for these things, more like life services, because what you're talking about is what people need in their lives if they're going to be able to function and get access to the health care that they need and so forth. So that must be sometimes rather frustrating, that feeling that you're getting back from folks when you talk to them, where they feel like I haven't been heard, or that there just doesn't seem to be, or I don't even know what questions to ask. Would you say that's been your experience?
Yeah, absolutely. I've worked with a number of clients where like I get on the phone with them and they're just like close to sobbing with like how much they have tried to get what they're looking for. I've had clients who were trying to restart old businesses they were trying to get done, or maybe go back into education or get a job. And you really see the frustration that they go through, and it can be very difficult. And as someone who, I guess I could say at sometimes I can be privileged in the way I was raised, it has really taught me that like even seemingly simple tasks can become way difficult when you don't have access to these resources that should be simple to get, like transportation or childcare or just health care in general.
Well, that's a topic for another show, I think. Now, Patrick, you're in medical school.
Yep.
Having done your rotation here at Mercy, how do you think your experience with this program has benefited you, helped you in your journey to become a physician?
Sure. I've talked at length about this exact thing with some of our advocates, and I think the two things that Health Outreach Baltimore has given me as a benefit or an edge is being able to look at that closed door and being able to walk into someone's hospital room or into the OR and understand the social context that someone's pregnancy exists in. Right? There are certainly a lot of medical considerations about someone's pregnancy and someone becoming a new or expecting mother. Those types of things we learn in medical school. But my time at Health Outreach Baltimore helped to define what that social context was, what that milieu of pregnancy really is, and how it includes much more than sort of sometimes what we see on the surface in medicine. And as you alluded to, the central parts of someone's life that are sometimes defined as like ancillary support services are really the core needs someone might express to us. So I think that has certainly been like the biggest benefit that I've received working with Health Outreach Baltimore in undergrad, and something I've taken into my time in medical school.
Dr. Alice, what's your opinion of the students that you've worked with? And do you think that this program is achieving its goals?
Oh, I think absolutely. I mean, I see these young upcoming professionals, conduct themselves incredibly well, poised, confident in what they're doing. And it's just a joy for us to witness the help that they're giving to our patients.
Do you think that this is something that Mercy should be continuing with? Do you think it fits well into our values?
Oh, I think it's the Mercy way. I mean, to be honest with you, I love the fact that we have a group of students and group of individuals who are doing something that I can't do on a daily basis. I see so many different patients with different challenges. We talked about, travel. What we didn't mention was housing, unstable housing, where are they getting their next meal? These are struggles that our patients here have. And, in the United States, we shouldn't have such struggles. And it's sad to see. And I'm just happy that we can be part of a group of people who are really delving into some of these social constructs and trying to really impact our patients on a deeper level than I can even get to.
Mm. I'm reminded of when I went through orientation almost 30 years ago. And one of the points that was made is you never want to hear a doctor or a nurse or any other medical professional saying, I've got to go see the gallbladder in room 3. The idea being that we can reduce the person down to whatever their ailment is. And I think that's part of the problem that, sometimes our society runs into is that, again, they think about this, I'm going to call life services versus support services. They don't really consider those as something that plays a role in health. It's like, well, I've got a problem with my intestine or something, it's like, well, maybe it's because what my diet has been, maybe I'm not eating the right things. I don't have access to healthy foods. And so all these things are connected. And I think that's, to me, what's most striking about Health Outreach Baltimore is it brings home that message. Would you say so?
Oh yeah, for sure. It really does. That's something we're taught right from the beginning in our training sessions to make sure you're not belittling your client to just like the need. So they even tell us like not to say, oh, they like need this, like as if, oh, they need us or like they're dependent on us, but that we're specifically supporting them on things they're requesting. So not saying that they're not able to get it on their own, but we're just kind of helping to bridge that gap and make it a little bit more easier. Because one thing we've learned, we really cover social determinants of health very well in this program. So you learn that there's so many different things that impact a client's health, just besides like the specific ailment that they're experiencing. So making sure you're not belittling them to that specific ailment and also considering all the other factors that are impacting their health overall.
If I may, that is this care for the whole person. That is a central idea of Loyola's mission for us as students. And it aligns with Mercy's mission for its patients. Dr. Atlas and the whole team at Mercy has allowed our organization to really engage in that cura personalis, that care for the whole person. And in medicine, we talk about holistic care of the person and humanism and caring for each part of what a patient comes to the office with. And I think our organization helps to bolster the parts that sometimes slip through the cracks.
Is there anything else about this program that you would like our viewers to take away from? And what's the major message, in your opinion? This is for all three of you.
I think for me, one thing I take away 100% is that we are really empowering families by bridging the gap between accessibility and availability when it comes to connecting them to healthcare and social support services. Because there's one thing to have resources available, there's plenty of resources out there, but being able to make it accessible is the big, huge factor, and that's what's gonna help impact these people's health. So we're able to, I think it's really unique that HOB is able to do that, working individually so closely with families and clients, to be able to bridge that gap and make sure that they're able to get everything they need so that they can live happily and healthily.
For me, it's that healthcare is relationship driven. And that is something I had the chance to learn in undergrad. For students, it's a reminder that long before you put on your white coat, long before you step into the office or the practice that you decide to join, you are integrating yourself into an endeavor that is solely relationship driven. It allows you the venue and the opportunity to build those relationships, to build your empathy, and hopefully to reach out a hand to those who could use it or ask for it.
All I can say is I wish that when I was growing up and in college, that there was a program like this, because I think it really gets you to understand human life, struggles that people have. Whereas, just what pre-med was back, I hate to say it, 40 years ago or longer, was like. And, we were just concentrating on subject material, where I think this is the kind of thing that gets you to understand really what this is all about, what human life is all about, and how much we need to care for patients, like you said, rather than your gallbladder hurting you, right? Mm-hmm. And truly, what I tell people about Mercy Medical Center, here's my plug for Mercy, is the fact that we care about the individual who comes through our doors. And I think patients sense that and feel that, especially if they've had other experiences, other organizations, whether it's local or outside. We care about the individual not just their disease process.
Well, I'd like to thank you all for coming in today, and to all our guests on Medoscopy. Hopefully everyone learned a little something about this very interesting, intriguing, and I think very important program that's making a difference in so many people's lives. And thank you for watching. On behalf of myself, our guests, and the Sisters of Mercy, we wish you good health and humor. And until we gather again, may the road rise up to meet you.